My name is Brent Neribarger, and it was a beautiful weekend. I was with my wife, Jennifer, and last thing I remember is that we were on a beautiful excursion on the boat, and all of a sudden there was a massive crash. Last thing I remember was looking at Jennifer, and then it blacked out. 2 days later, I woke up in the hospital to find out Jennifer was still in critical condition, and thankfully I was okay, but her condition was far more severe than we would have thought. Come Saturday morning, I was updated on Jennifer's condition. The doctors told me that she was currently on a ventilator and that she was sadly in life critical condition. Thankfully, as the days passed, I was given good news that Jennifer's condition had gotten better and it was time to take her off the ventilator. Soon after that, we were able to have Jennifer walk around. She was able to communicate slightly with the nurses and me, and it looked good. Come in.
Hello, Mr. Newberger. How are you today?
I'm doing good.
Hi, my name is Brandy. I am your wife. I am the nurse taking care of your wife today. How are you doing, love?
I'm good. How are you?
I'm okay. So, like we told you yesterday, your wife is off the ventilator. She's doing so much better. I did her assessment this morning. I checked her breathing, her heart. Everything seems to be working perfect right now. The provider did order X-ray with biome. So we're gonna do that. Do you have any questions for me before we get started on that?
Oh, you said you're gonna be the one doing the barium?
Yeah, so I'm the nurse and it is my responsibility to administer the medication. And before I do that, I will be checking her, making sure she's the right patient, the right name, the right time, making sure she doesn't have any allergies to the medications. Any more questions for me? Okay, so since we don't have any questions, we're just gonna go ahead and get started in administering the medication, and then we'll be taking her down for X-ray. Okay?
Come in.
Hi, Miss Jen. How are you feeling, hon?
I'm good. How are you?
Okay, so like we told you earlier, I have your Valium medication that you need to drink before you go to your X-ray. Okay? And this is going to be your X-ray tech. Okay?
So we're gonna go ahead and start doing your X-ray. It's gonna be a barium test.
What
Uh,
is that?
so it's gonna be barium contrast, and it's gonna be a white coat, and it's gonna go through your esophagus, stomach, and GI system. So that's gonna coat all your GI system, and it's gonna have a better visual of your GI system when we do an X-ray.
Okay, and I have it
Is
here
it
for
safe?
you. Well, it's safe. We checked it and we double checked that you don't have any allergy to any of the ingredient in here, okay?
Okay.
All right, whenever you're ready, love, you can check that for me, okay? All right, thank you. Okay, the floor is yours.
I was happy to hear that Jennifer was going to get a barium x-ray done. The doctor went ahead and gave her a green light. But what soon happened is that she would have a complication called a TEF, which had gone unnoticed. A TEF is actually a trachea esophagus fistula, where actually there becomes a hole between the trachea and the esophagus. So when she went to go do the barium exam, and she swallowed the barium, it would actually happen to go through the trachea and into her lungs and would soon cause further complications.
Hey, Miss Jennifer, I'm just coming back to check you after your X-ray. How are you feeling, hon? Are you okay? You okay? Miss Jen, can you hear me? Code Blue, I need help.
After 14 minutes of trying to resuscitate Jennifer, sadly, the healthcare providers could not bring her back to life, and she sadly passed away. I'm trying to understand how yesterday Jennifer was perfectly fine. She got a green light to do the barium x-ray, and now today I find out with the TEF complication, she's now dead. And after searching through thousands of pages of her medical record, I have only been able to find one paragraph in which it discusses this medical condition that's very serious in nature. And I'm trying to understand how can this get overlooked, and how can the nurses find this information when it's only included in such a small amount.
Hello everyone, my name is Eric, the State Board of Nursing representative.
My name's Sarah. I'm the risk management representative. Do we have any questions today?
I actually do have some questions. Dominique here from VC News. I'm wondering if you could tell me what constitutes a medication error.
Well, a medication error constitute giving the wrong medication, omitting a dose, administering the medication or the wrong patient, using the wrong route or time, or failing to identify a contraindication or allergy from a patient.
So in cases of the medication errors, what is the responsibility of the faculty and the administration there?
So we usually just ensure policies and procedures are in place for safe medication practices, doing proper training, usually maintaining safe systems, and ensuring clear communications between the patients itself.
So have you guys identified any risk factors or anything that could contribute to more medical errors?
Well, a couple of those will be look-alike or sound-alike medications, high workload, and lack of knowledge.
And so when these errors do occur, like who exactly is responsible?
It's usually the person that is giving the medication itself. It could be the healthcare provider, as in the nurse, the pharmacist, the physician, the faculty for system-related causes or inadequate support.
So yeah, just one final question to kind of wrap this up is, what is your guys' procedure when these medication errors do occur?
Well, the procedures that we have in place are going to be ensuring the patient safety first, report the error immediately, document everything that has been done, complete an incident report, notify the patient's family, review and analyze the incident, and implement corrective actions.
That's all the questions I have for you guys. Thanks.
Thank you.
Thank you for coming.